evening, everyone. Welcome to our first live event. My name is Nabila Lehe, and today we will be interviewing Sanelisiwe Mthembu from Crafty Speech Therapist. Now, before we begin, I would like to tell you a bit more about what Rehab for All South Africa is about. We are a social platform that promotes innovation around people with disabilities through creative rehabilitation services and use of technology. We do this by promoting specific thoughts and ideas through our social media platforms and engaging various people towards this cause. If you have not liked our page already, please do. And you can also click the sign up button on our Facebook page, which will sign you up to our mailing list and where you will receive constant updates about our work. Please do feel free to comment during this live broadcast. We would love to hear from you, any thoughts that you might have, and also any questions. Now, one of the things that we promote at Rehab for All South Africa is for health professionals to apply their knowledge in creative ways. Today I'm really excited to have Sanelisiwe here. And Sanelisiwe is a speech therapist from Durban who is passionate about creating family-friendly services. Not only does she work as a speech therapist, but she also has an extensive online presence where she creatively sends her knowledge through. Sanelisiwe, welcome. It's a real pleasure to have you here today.
Thank you so much for having me. Thank you.
Now, before we begin, for those viewers who might not know what speech therapy is, can you tell us more about what speech therapy is and what are the types of patients that you work with?
Okay, so speech therapists, we deal with people with communication disorders and swallowing disorders. So perhaps if you have a child who has delayed language or delayed speech or speech disorders or language disorders, we help those children. We mainly work with children with disabilities, such as children with autism, children with ADHD, children with cerebral palsy, and also we work with children in a school setting, like children who are having difficulties with their academics, with learning disorders or learning difficulties. So in the school setting, we try by all means to help the children function well and try to prevent failure. And then in the hospital setting, because we also work in the hospital setting, we also help their children with disabilities and adults as well with disabilities. So there we help people with swallowing disorders most of the time. Perhaps like if an adult had a stroke, we do help adults with strokes. We help them swallow better, help them communicate better, because once you have a stroke, most of the time you have a problem with swallowing. And most of the time also you have trouble with or problem with speaking. So we help them with all of that, and also we help people with perhaps like if they have like stuttering problems. I also used to stutter a lot. I'm still struggling a bit, but because of the knowledge that I gained, because while I was pregnant with my twins, I had some seizures, and then it really affected the way that I speak. So, but now I've kind of like recovered. So when I'm with patients with who have like fluency disability, like who have fluency difficulties or stuttering difficulties, I usually understand them because I've gone through the same thing, So I'm usually very sympathetic towards them because I know how it is to actually have a communication difficulty. Yes, so speech therapy is such a broad field because we also help people with voice disorders. If you have a voice disorder, we also help you. It's such a very broad field.
Now, do you think? Thank you for that. Do you think that many people around you have problems in accessing services like yours?
Of course, because just here, because I'm based at Umlazi. Umlazi is in Durban, in KZN. So it is a township. It's a very small township. And here, there was no speech therapist, private speech therapist here, except until like I started my speech therapy practice. And there's just only one speech therapist who is in Mshiyeni Hospital, which is a public hospital here. So there's just that speech therapist, and I'm the only one who is a private practitioner. So most of the time when patients wanted to see a speech therapist, they had to travel. And just in the beginning of this year, I was helping a patient in Pinetown. Pinetown is far away from Umlazi, but the patient lives in Umlazi, but was going way there, like was going to Pinetown to get these services. And people don't know about speech therapy. So for me, I thought the best thing that I can do is just to teach them, because we as professionals, we need to advocate for our fields. We need to let people know that we are here. So that is what I've been doing a lot via social media, and with collaborating with radio stations, trying to get people to know speech therapy, because they cannot search, they cannot look for something they don't know. So they need to know that there's something called speech therapy so that they can be helped, you know.
Do you see social media as a way for you to broaden this awareness of speech therapy?
Of course, because last year I was because I'm kind of like an artist. I'm an artist by nature, and then I just found myself, in speech therapy, and then when I saw that I can actually link or merge speech therapy and my art and my love for photography, I was like, oh, social media can really make me do both of these things, can make me be this speech therapist who wants to reach people and who wants to help people, and also can make me to be this digital creator, you know. So I was like, okay, let me just go into social media and let people know more about speech language therapy, because they really don't know. They really don't know, especially here where I'm at Umlazi. And that is why some of my content and more of my content is going to be about isiZulu, because I'm here in Durban and most people are speaking isiZulu. And so it's actually...
Do you think it's important that we put out more content, health knowledge in Zulu and other indigenous languages?
Of course, I really do think so, because when you speak that person's language, they actually feel like connected. They actually feel like you understand them, and it's actually kind of like they feel that you care. Actually, you actually care about them, and you actually really want them to understand what you're talking about. Because that's the feedback that I got from people when I made my first video, my first isiZulu video, which was talking about speech therapy. It was a 10 minutes long video just talking about speech therapy, because it's a broad field. So you cannot just make just a 2-minute video to really try to explain everything about speech therapy. So it was in isiZulu, and I tried by all means to use the Zulu that people can understand, because you cannot use the Zulu that they cannot understand, because there are different types. So it really does help, and it's really important to use people's language, especially those you are serving. I mean,
I absolutely agree with you. So I'd love to show our videos a clip of one of your videos now. This video is not in Zulu, but I think when I saw it, I absolutely love it. So I'm going to share my screen for a second.
Okay.
Okay, give me 1 second. Okay. And then I'm going to play this video, which I found on your website, which is called speechtherapist.com. So let's go here. And this one was a message to parents with children with communication difficulties.
Hey everybody, it's Annalisa Ntendi here. Thank you so much for joining me today. So today I wanted to talk to parents. I had a question that I'm going to answer right now. So this is a Q&A kind of video. So the question is, what is your best advice to parents with children with communication difficulties or any other types of disabilities? So this question is really, I got it because it's so important that parents get this. So if you have a child with any kind of difficulties, I know that it's hard. As a parent, you're doing your best and you're trying always to push your child to be that best. You're doing this for the child, but the important thing is releasing the pressure. Do not force your child so much. Do not pressurize your child so much, and yourself also. I know that you want the progress, you want everything to be fast because we want our kids to be the best and don't want them to struggle, especially at school where there are other kids. You don't want them to feel like they are judged. So it's so very important that you do not show your child how stressed you are. It's so important that you do not pressurize your child. That is why speech language therapists will teach you ways in which you can correct your child at home in a way that will not make them feel like they are worthless. That is why we're encouraging parents to play with their kids, even in therapy most of the time. As a pediatric therapist or speech therapist, we like to use play and just use play in our sessions to help the child improve their speech and language, because we want the experience to be fun. We don't want the experience to be bad for the child. We want the child to keep on having that self-esteem, because if you pressurize the child, you are lowering down the child's self.
Okay, we're going to end it there. So what strikes me, hold on, cool. So what strikes me about your video over there is that you really seem to empathize with the parents, and you also put so much of effort into the visual art of the video. How do you do that?
You mean the quality of the video
and you put a lot of effort into that. How do you have the skills to do this? Do you do it by yourself?
Yes, of course. So last year I was doing my community service. So I just I just finished my degree. So last year I was doing my community service, and I just fell in love with videography, and I just tried by all means to find ways to create content in a short period of time, because I wanted to create quality content in a short period of time, because I had so many things to do. I'm a speech therapist, but I still wanted to create something that will appeal to people, that will look so good. So I just continued, I just started to take videos and started to edit, and I just made sure that I'm going to use my phone, because the phone is accessible, it's easy to use. And then I found apps that were very good with editing, and then I started to be creative. It does take time. I don't want to lie, it does take time, but if you're passionate about something, you just keep on learning, because I was really passionate about it. My first video, if you can see my first video that I made, it was so bad. But then I just told myself that I want to master this. I would look at how other content creators created their videos, and then I would try to create that using my phone. And then the more I did it, the more it just became so easy, and just so easy. And then I just kept on doing it, and then it became even more easier.
One of the things I also noticed on your website is that you create lots of types of content. I saw things where you gave developmental milestones to parents, and other things where you promote things like speech therapy and give exposure to the profession itself. I mean, that comes through very, very strongly. How do you decide what you need to be creating?
Okay, so because I want to help, I work with children. I actually prefer to work with children. I love to work with children. And my first videos, as you said, my posts in Instagram and Facebook were all about developmental milestones, because I really feel like early intervention is so important. I really wanted parents to really look at their kids and see if maybe they have any type of difficulty that will need a speech language therapist. So every time, actually, it's when you just have to be kind of like to have those marketing skills actually, and to be creative. Because every time I feel like I want to work with a certain type of patients, because I do want to grow. So every time, like the first week of my practice, I was posting mostly about developmental milestones because I wanted to get more clients with developmental or delays, or speech delays or speech disorders. So when I posted those videos, that is when I got clients who needed that help. And then as I went on, I wanted more clients with fluency disorders because I felt like I wanted to gain more exposure and get more clients like that. And that is when you can see in my Instagram, that is where I was talking more about stuttering. And also there were some people who approached me who told me that they had kids who were stuttering and stuff, but what they did is they didn't ask for maybe like appointments and stuff. So that is where you need to be creative as a business person, and also as a speech therapist, as a business person. So like I thought, because they are already following me, they're already telling me that they have kids with stuttering problems or with fluency disorders. So I decided to make content for them to make them feel like I know what I'm doing, and to make them feel like they can trust me. So I created content around that, and then immediately they booked for appointment. Immediately they acted towards helping their kids. So it's all about that. I see, like, it's all about who DMs me and what do they say to me, and then I create content that will make them feel like they can trust me, you know. Yeah, that is how I use social media most of the time, to just make people see that they can trust me with their lives, with their children, and make them see that I know what I'm doing, so that they can ask, or maybe like book for appointments and come to see or go to other speech therapists. Because I don't only talk about me in my page. I really advocate about speech therapy, you know. Yeah,
Yes, and
as
this
a
is
whole.
something I really, really noticed that you do a lot of. My favorite post is something where you went on the radio and you said you're going to preach the speech therapy gospel.
Yes. Yes.
I loved it. I thought you are such, for many of us, we're just so afraid to go onto social media, but you've shown how we can use it as a way to advocate for better health services for people and to raise that awareness. And I think one of the other things you've really taught us today is that the link between this responsibility and the business element of your practice, and how it
Yes.
brings patients to you in the end of the day.
All of my patients come from social media. All of them.
That's that's really, really interesting. And can I ask you as a last question, do you have any tips or advice for health professionals out there who want to put themselves out there more? What should they be doing?
Okay, so there are different ways to approach social media. It depends what you want to do. Some, like me, for me, it became like I put myself out there as a personal brand, who, like, is a speech therapist who has a company called Crafty Speech Therapist. And then there's someone who will come in and have a social media account that is just about their business, where they don't actually speak about themselves, where they just speak about the perhaps like the services that they are rendering to people. So it depends how you want to approach it. It's either you go personal, you share your experience, or you just deal with the business or with the services that you're dealing with. So if you want to go personal, that is where you share your life, because some people, like here in South Africa, I feel like most young people who are in universities, they do want to see a life of an audiologist. They do want to see a life of a speech therapist. So you can go through that route and share your life and just let us see, because there's no, like, we don't know. When I was in university, I wanted to see a life of a South African speech therapist in social media, but there was no one there. And then you'll see like Americans doing it, and then so I wanted to do something like that, but I also was I also thought about my business. I wanted to push my business more because I just started my practice, but that is the way that that's the routes that I want to take. I like the whole social media thing and like the personal brand routes. That is where I'm going. So it's still a long journey. And then if you want to just stick to your business, if you just want to grow the name of your business, then you do just that. And what's great about that is that you can have anybody create that page for you and grow that page for you. And I actually do that for other therapists, where I just grow their social media accounts and help them grow. But there's nothing personal in this, just growing a page and getting patients for the practice. So most of the therapists that I've been talking to, they choose that route because they can have someone posting for them and they don't want to go too personal. So that is fine, and you can always do that. But I don't know if you get what I mean.
I think that's really valuable advice. And I want to ask you, how can people get into contact with you or view your work? Can you give us your details?
Of course. So in Instagram, because I like Instagram more. In Instagram, I'm Crafty Speech Therapist, and then in Facebook, it's the same, Crafty Speech Therapist. So I also opened up a YouTube channel, but I haven't been active in it. I've been just taking the same videos and posting them to YouTube, but I'm still going to be more active, but not now because I'm still building my business. It takes a lot of time. So it's just Crafty Speech Therapist in Instagram, Facebook, and YouTube.
Thank you so much, Sanelisiwe. I think what I've got from this is just you are such an inspiration in your creativity, and for many of us, I think today, health professionals, we've got so much of value to give in society, but we just need to take that step and that courage to give it out in creative ways. And your work really, really reflects that. So thank you for coming today. And thank you for sharing this with us. It was such a pleasure to have you, and we hope to share more of your content in Rehab for All South Africa. And I hope that other therapists will start to share your content as well, because it's so important.
And thank you so much.
You're welcome. And finally, to our viewers, I'd like to say thank you for joining us today. If you haven't already, click the sign up button, Rehab for All South Africa. Please do sign up for our newsletter. You too, Sanelisiwe. We hope to see you in our newsletter as well. And I just want to tell you about, we are planning some exciting events, especially next month at Twitter. We are hosting our first ever Twitter chat, where we will be talking about how disabled people are treated in our society. So it's going to be something really exciting. Lots of stakeholders and different people will be joining us, and we hope that more therapists will join us as well. And to all our viewers who joined, thank you for the great comments. I've got someone saying that, they never knew how broad speech therapy is, and your comment about trust being really important with patients. I think we've all learned a lot. So thank you very much, Sanelisiwe, and to our viewers, good evening. And bye-bye.
Thank you so much. Bye.